name is Ali Wald, and I work at St. A's. I'm a physical therapist.
And tell us about your education path.
I kind of knew I wanted to be a physical therapist, so University of North Dakota has a good program, so I went there for my undergrad knowing that I could just go to the physical therapy program. So 3 years of undergrad. Most people do 4 and get their degree in something else, but I just did 3 and cut a year off and then applied for the therapy program, and that was 3 more years. So 6 years total. It usually takes 6 or 7 years.
So what do you do in your job?
Well, me specifically, I work in a hospital setting, acute care they call it. So we see patients who are in the hospital with, if they were weak and they fell or whatever, or they just are getting really weak for a medical problem, or if they have get a knee or a hip replacement or a back surgery and need kind of help to rehab that. So we see them in the hospital when they can be pretty sick when we see them. That's kind of the patients that I see, but there's so many, a lot of people just work in an outpatient clinic where they're just doing sports injuries, or we have therapists who just work with kids, who the kids come in every day and see them. So there's just so many different areas, I guess.
How many hours do you normally work?
I work 8 a day, 40 a week. And that's variable too. I mean, if you're working in an outpatient clinic and stuff, you can kind of set your own hours or set your schedule. And even here, if the hospital's not busy, then we might get done an hour early if there's not enough patients to see. But usually that's not a problem.
Do you take work home with you?
No, everything that I do is on the computer. If I need to research a diagnosis or something or treatment, I will do that, but all the paperwork's on the computer, so I can't really do that at home. I know some of the peds therapists have tons and tons of paperwork for insurance and stuff, so they have to take stuff home because they have to write basically novels about what they're doing, but I don't ever have to, so knock on wood, yeah.
How would you describe the pace at which you work?
Fast, very fast. And again, it depends with the patients. When we're working on the orthopedic floor and it's all like total hips and total knees, you basically are seeing like a patient every half an hour, and it's like quick. If you're working on some other floors, it seems like it's a little bit slower because patients are busy or they're getting a test, so you're kind of trying to find people to work with. But it's busy. I don't really feel like I'm sitting around ever, which is nice.
That is nice. What were your favorite classes in college, if you have any?
Yeah, right? Let me think. Oh, feels like it was so long ago. We did in physical therapy school, we do a lot of labs classes, so those are nice just because you're practicing on each other and doing the hands-on stuff. So anything where we could not be listening to a lecture and doing labs was probably the best.
Was labs a common thing?
Yeah, we usually had probably 2 a semester, where you're doing labs a couple times a day, and then the other ones would be sitting in the classroom and lectures. So the labs were much better, just working on manual skills. Yeah.
That's always better.
Or clinicals where we're actually not at school at all and just doing internships are probably way better.
How has your education prepared you for your career?
I feel very well prepared. I mean, I don't think nothing can really prepare you until you get the experience and stuff, but we had the internships, which are better than the classes that we took. But I mean, I felt like I had a good basis background, and there's just so many different areas that you can't really cover all of it. It's just kind of experience, and if you get to experience the different areas.
Have you worked in other jobs like this?
I worked in a hospital setting in Minneapolis for a year, and then I moved back to Bismarck and worked in a geriatric clinic, just working with older people, more of preventative maintenance care. They weren't really sick when we'd see them, and then came back to this job, which is the job like I had in Minneapolis, which I like. It's just busy and you see new patients every day. It's not monotonous.
Variety.
Yeah, big variety.
What would be the starting wage for a job like yours?
In North Dakota, it's probably right around 25, 26, somewhere in there. It varies with state and what area too. I know some outpatient clinics that are private you could probably get a higher wage. At the nursing homes, you probably get paid a little bit more, but there's a pretty high demand in Bismarck area for physical therapists, so it's probably around 25, 26.
Why did you choose this career?
When I was in high school, I had surgery on my knee, and I really liked my physical therapist. And I had to go to him like every day. Well, it took forever to get better, so I just kind of got interested by going through it, and then I did some observing and stuff like that, so probably just the experience I went through.
What goals do you have in your career?
I'd like to, like I said, with physical therapy, there's so many different areas, and the acute care is pretty basic. I mean, you're still seeing, every day it's different patients, but it's not such a specialty. There's a lot of specialty sublets that I'd like to, get involved in. I'd like to do some stuff with pediatrics and see how I like that, and spinal cord injuries and things like that are intriguing to me, but a lot of it's extra training and stuff like that, so hopefully just doing more of that stuff to do those specialty areas. It just gives you a little bit more variety of stuff you can do too.
What do you think it takes to be successful as a physical therapist?
I think you need to be patient, because a lot of our patients sometimes can have memory dementia stuff, and if you want them to do something, sometimes they just can't. So I think patience is a huge thing, and you don't see progress overnight. It takes a while, so being patient with that is helpful. And I mean, you want to be a good people person and be able to work with patients, because that's what we're doing all day. I mean, there's days when I'm tired and want to sit behind a desk, but that's not what I do. I have to be out working with people and talking to them, so being good with people and having good social skills, I think, is really helpful.
Do you travel for your job?
I don't. We have therapists here that one of them goes to Fort Yates once a week to do pediatric therapy, and we have home health care therapists that go all over town and in the area, but I don't at all so far.
What are the most difficult decisions to make in your career?
In the hospital setting, oftentimes families or nurses or doctors come to us and ask us, well, can this patient go home? So sometimes I feel like, are they safe to go home? Are they okay with walking and stuff like that? That can be stressful, just because you're kind of the one that's saying yes or no. So if you say yes and then they go home and something happens, you maybe feel responsible. Or if you say no, then they have to look at, alternatives, nursing homes and stuff like that, and that can be expensive, and that can be hard for families to do too. So that's probably the most stressful, because it's kind of a big decision that sometimes they ask us to, make the final call for. So.